Well, here we are for number 47, and I'd like to highlight yet another serious and very concerning example of waste: improper payments of taxpayer money through Medicare. All of us agree that Medicare is an important program for millions of Americans, and we need to do what we can to preserve these important health care benefits for those that depend on them and need it. But an essential part of preserving these benefits is protecting Medicare from waste, fraud, and abuse. Throughout its history, we have read, and it has been determined by inspector generals and by the Government Accountability Office, that Medicare has been plagued by improper payments, which are payments that are not justified but do occur because of fraud or bureaucratic mismanagement. These improper payments not only threaten the solvency of Medicare, they leave millions of seniors vulnerable. Because when these improper payments are the result of fraud and abuse, they can jeopardize the health and well-being of Medicare beneficiaries for this reason. The reason is that Medicare is going broke. It's careening toward insolvency. The Medicare trustees have said that we're only 12 short years away of insolvency under Medicare. And so when you determine waste, fraud, and abuse on a year after year after year basis in the billions and tens of billions of dollars, these are dollars not available to keep that program solvent. And that's going to have a devastating effect on the ability for us to provide the Medicare services that people of a certain age need. How many taxpayers' dollars am I talking about today? Well, in fiscal year 2015 alone, just in that year, the last year where the audits have been done, the Centers for Medicare and Medicaid Services, or CMS, which administers Medicare, improperly paid out $59 billion for health services. In one single year, $59 billion of improper payments, representing nearly 10% of the total amount of Medicare spent that year. Just last week, as I said, the Medicare trustees said that it would be insolvent by 2008. Think about that, just that 1 year, that $59 billion could do to help keep the program solvent. All of this is why it's all the more necessary for Congress, the administration, and the health care agencies to work in unison to solve this crisis of Medicare insolvency. There's a group known as the Medicare Fraud Strike Force, and I commend whoever put that idea in play. It needs to be advanced significantly, but the idea here was the strike force could root out the bad actors and bring them to justice. And recently, as an example, the strike force uncovered a ring of over 300 people, from physicians and pharmacists to nurses and government officials, that have allegedly conspired to defraud Medicare out of $900 million. How did they do it? Well, some of these examples of this fraud ring includes the billing of Medicare procedures the providers claim took place after the patient passed away. They were submitting Medicare claims for dead patients and receiving significant payments in the amount of $900 million. Other providers billed Medicare for home health care, which is reserved for bedridden seniors, for services that not even were provided to the patients in need. There was fraud in terms of people submitting bills to CMS and receiving payments when the services were not provided. In Detroit, a so-called medical clinic billed Medicare for tens of millions of dollars when in fact the clinic was determined to be a front for a narcotics diversion scheme. The clinic operators and recruiters targeted poor drug addicts in need of help and offered those addicts narcotics so the clinic could then bill Medicare for services that were not provided. Tens of millions of dollars. So these are just examples of what the Government Accountability Office found and the IGs found in terms of looking at Medicare payments. And that's why I continue to come down here every week to urge my colleagues in the Senate, in the House of Representatives, and the administration to take the necessary steps to tighten the screws on bad actors in Medicare, in agencies across the realm of this government, not only because they are gambling away with the health of some of America's most vulnerable patients, but also because we have such precious little time to work to save this program from insolvency. Our goal should be, in fact, it must be, to protect seniors, to promote good government practices and achieve real savings by addressing these issues now. So with that, I'm adding another major amount of waste, fraud, and abuse to our ever-growing total. This week, $59 billion for Medicare improper payments, bringing our total all the way to $234+ billion of waste, fraud, and abuse of hard-earned taxpayer dollars. And we wonder why the public has lost confidence and faith in their elected representatives, in their institutions of government, when they see this kind of bureaucratic mess. We see this kind of waste of hard-earned tax dollars, the fraud that is involved here that is not detected, and the abuse, and the terrible decision-making of people who respectfully work for government agencies, but don't exercise the kind of judgment that the American taxpayer expects from them in terms of dealing with the money that they send here to Washington. Mr. President, with that, I yield the floor.